64 new cases of coronavirus in the state today. That takes us to 701 active cases of COVID in Victoria. The Minister's gone through those in hospital, 42 Victorians in hospital, 13 of those are in ICU, 8 on ventilators. And in terms of the age profile, we have 60% of those in hospital are under the age of 30. 60% of all of our cases are under the age of 30, and 149 of our cases are under the age of 10. In terms of those that are in hospital, in ICU, in their 20s, we have 1 person. In their 40s, we have 8 people. In their 50s, we have 2 people. So again, a very young age profile for those in hospital. 26 of the 42 people who are in hospital are under the age of 50, and that includes 1 infant. We have 18,244 primary close contacts across all the outbreaks at the moment, and 17,230 secondary close contacts. In terms of the 64 cases today, 7 of those are associated with the Shepparton, 10 are associated with our Broadmeadows cluster, 7 in the Carlton and Brunswick area, 1 associated with Altaqua College, and 1 case in the city of Dandenong. We have 9 further cases that are linked to cases we've identified in recent days, and we're still working on their linkages, but they are now connected. And we have 1 case under investigation. That takes us to 36 of the 64 cases today. An additional 21 cases are located in the western suburbs and linked to the western suburbs clusters, including 9 in Wyndham, 8 in the Newport and Altona North area, and 3 in the City of Hume area. And then finally, we have 7 cases in an area around Port Melbourne and St Kilda. That takes us to 64 for the day. 49 of those cases are clearly linked to established outbreaks and clusters. 15 of those cases remain under further investigation. We now have 41 cases in total under investigation at this point in time. 20 were cleared yesterday, so we continue to see good progress. So my thanks to our phenomenal contact tracing team and epidemiologists for the amazing work they're doing in giving shape to these outbreaks and giving us active lines of inquiry to work on. In terms of the major clusters that we're working on, Shepparton continues to be a very significant outbreak with 85 positive cases. That's an increase of 7 on yesterday. Over 9,000 primary close contacts and just great testing rates. 83% of those have now returned a negative test result. The one we now feel increasingly that Shepparton is starting to look like a very clear shape to Shepparton. We understand the linkages. It is all part of one significant cluster and a phenomenal response from the wider Shepparton and Goulburn Valley community. One of the new little outbreaks around Shepparton has been the aged care facility at Echuca, Warfarilla, where there are 88 residents. I can confirm that there was a staff member who tested positive at that aged care facility, and that is a confirmed positive test result. She has since tested negative. So the positive test stands and the negative test stands. We also have tests of her household, which is connected into the Shepparton cluster through work and other reasons, well established and all legitimate. We believe that that household is coming to the end of its infectious period. We are doing serology work to establish fully the nature of those cases and what their timeline has been. We still have that infectious exposure at that particular aged care facility on the 20th of August. Testing was undertaken yesterday of all the residents and the staff. We still have around 40 staff on furlough at that location. It highlights again the importance of vaccination. This staff member was fully vaccinated, so we hope therefore to see very limited onward transmission, but the results will tell in the next day or two. I can confirm that 92% of the residents had at least a first dose vaccination, and the vast majority had already completed their second dose vaccination, which is a very encouraging sign. Of the 182 staff, 56% had at least a first dose vaccination. A vaccination team was on site yesterday to do some additional vaccinations, and I believe some of those were taken up. In terms of the Royal Melbourne Hospital cluster, that is no new cases today. That's now a total of 19. We continue to have 372 staff furloughed at the RMH, and again, my thanks to the whole team at RMH for the phenomenal work they're doing to keep our critical services going. The Broadmeadows cluster does continue to grow. There's 102 active cases now associated with originally the My Centre Childcare Centre at Broadmeadows. It's an increase of 10 on today. Over 1,000 primary close contacts. Almost 70% of those have returned a negative test result. And as I explained yesterday,
We've seen it spread from the original staff and children at the Broadmeadows Centre and now go through wider households associated with the Broadmeadows Child Centre community. I met with some of the community who have children at the centre last night. Some very moving and some very honest stories around the challenges of young children picking up COVID and the implication on their wider families. And my thanks to the community groups who came together last night to share those stories and to share the lessons around how we better manage the risk of COVID spreading through our communities and through our families. At the Carlton Brunswick cluster, we now have 35 cases. Some of that is associated with earlier public housing outbreaks, and those cases are all safely accommodated in the hotel quarantine programme. We do have 3 of those 7 cases associated with the Coles at Berkeley Square. In Brunswick, we also have 4 further cases of those 7 that we're still working on the exact linkages at this point in time. So very keen to ensure we maintain that good grip on that Carlton Brunswick cluster and more work to be done on that over the next few days. The new cluster of some concern is around the Port Melbourne area. So we've talked many times in the last week around St Kilda and St Kilda East. We do have 2 more cases in St Kilda East, but they are primary close contacts. We're not too concerned about them. But in Port Melbourne, we have a cluster of 4 cases around the Woolworths at Fisherman's Bend and an auto mega warehouse, car wash, car dealership complex at 467 Plummer Street. There are a number of exposure dates and times that are going up online, but essentially between the 13th and 23rd of August, around that Woolies, we now see a cluster of those 4 cases between the Woolworths and the car dealership stroke detailing shop next door. If you have used those facilities in the last 10 days between the 13th and 23rd of August, please look out for those exposure sites details and come and get tested. We've not seen that crop up before, so we're very keen to make sure that that doesn't become anything else. And then again, we continue, of course, to work very closely with communities and leaders across the western suburbs. 162 cases in total, active cases in total across the western suburbs. That's an increase of 21 on yesterday. Again, very high testing rates, very high testing demand, and my thanks to everybody who is working so hard in those communities to support that testing effort and to support the work that so many thousands of people are doing in isolating safely and protecting all of us from the ongoing spread of COVID. In terms of testing, a record last 7 days, 354,000 tests, just over, completed in the last 7 days. 98% of those test results all back by the next day. Again, can I thank those over 350,000 Victorians for coming forward and getting tested over the last 7 days. That's how we're bringing the Shep cluster under control. That's how the Royal Melbourne Hospital cluster is being firmly under control. And that's why we're making good progress with communities across the north and western suburbs and in those other areas of Melbourne that the Minister has referred to. Finally, briefly on vaccination, just an update, obviously a record day of vaccinations through our state clinics, but also a huge thanks and a shout out to the GPs and pharmacists that are also really now picking up the work on vaccination. Really good to see that over 50% of Victorians over the age of 60 have now had both doses of the vaccine, and we're seeing those numbers really starting to increase. And also over 43% of those Victorians between the ages of 40 and 60 have had both doses of the vaccine. So please, particularly those who have started the vaccination journey, make sure you book in your second dose that we're holding ready for you. And good to see the younger age groups, 37% of those in their 30s have now had their first dose, and 26% of those between 18 and 30 have had their first dose as well. We have 4 very large vaccination clinics, particularly in the west of our city, to really focus on those areas that are both younger but also less well serviced by the GP and primary care network. The showground site our showground site has over 1,000 vaccines a day that it's running through that very large facility. At Melton, we're doing over 800 vaccinations a day on average. At the Eagle Stadium in Werribee, we're doing over 600 vaccinations a day. And at Sunshine Hospital, we're doing over 1,700 vaccinations a day. There's also, of course, wonderful work being done by many GPs that we continue to support in the western suburbs. We are fantastic to see that every single vaccine dose that we're allocating out to our network, particularly Pfizer, is now being taken up with such enthusiasm.